Okay. All right, we'll start. All right, good afternoon, everybody. My name is David Mossberg. I am the designee appearing today on behalf of Secretary of State Robert Rodriguez for the March 21st, 2022 meeting of the New York State Hearing Aid Dispensing Advisory Board. I just want to make sure everyone can hear me pretty clearly or understand what I'm saying. Anyone having any technical issues or anything before we go on?
David, we can't see you.
Oh, you can't see us at all in New York?
I mean, I know
We can see everyone else.
Do you see Jack Bolello? I'm in the conference room with Jack. Oh, so I'm just literally not like on the screen.
Oh, okay. I get. All right. So it's just a matter of the camera not being situated in the right place.
Yeah.
I mean, do you want to switch? I can switch with you, Dave.
But you seem like should be able to, the camera should be able to catch everybody in the room.
Yeah. Is this any better?
Yes.
Yeah. Okay. Gotta get closer to Jack.
No. Dave, you want to switch?
No, that's all right. Yep.
They can see you now, so I can sit over here.
Okay. So why don't we go ahead and we'll start with roll call and introductions. We're also happy to mention that we have a new board member and as well as a special guest at today's meeting. So hopefully everyone was able to log on that we need. So I'm just going to start with roll call of the voting members. If you're here, just say present. Sharon Gavin.
Present.
Thank you. Peter Fisher.
Present.
Eric Freeman.
Present.
Dr. Anna Kim.
Present.
Jerry Bergman. Ann Orsine.
Present.
Marianne Zupon Wembley. I know we got an email from Marianne.
She's here.
She is?
She's wearing a mask and having a phone next to her ear in her office and waving.
Oh, we can't see her in our conference room setup here. Apologies for that if she's on mute. Okay. Obviously, I'm here. Jason Kramer on behalf of the Commissioner of the State Education Department. Jason, are you present? Okay. I know the AG representative isn't here. Dr.
Sorry, this is Brant Campbell substituting for the Attorney General's representative.
Oh, okay, fantastic. Brant Campbell. And new board member appointed on behalf of Commissioner Department of Health, Dr. Carl Alashir.
Yes, present.
Present. Welcome to the board.
Thank you. Thank you.
Can we just have a roll call of, so based on everyone present, appears as if we do have enough for a quorum. 2, 3, 4, 5, 6, 7, 8. Perfect. Can we just have members of the Department of State that are on the line, if you could just identify yourselves?
New York City, I'll start with New York City. Ernita Gant, Department of State.
Jack Bolello, Department of State.
Thank you. Any members appearing virtually from the Department of State online?
Emily Loopy, Processing Unit, Department of State.
Jody DeLallo, Director, Division of Licensing Services.
Shannon Mcguire, Division of Licensing Services.
Division of Licensing Services.
Denise Tidings, Division of Licensing Services.
Okay. All right, thank you. So the first item on today's agenda is actually to welcome the new board appointee, Dr. Alishar. So Dr. Alishar, if you could please introduce yourself to the board, and we're welcome to have you here.
Thank you very much. And I'm also very glad to be here and to join this board. I am one of the medical directors in the Office of Health Insurance Programs, which is the New York State Department of Health office that manages the New York State medical program. I provide, in general, clinical support to the Medicaid team, especially to the Medicaid managed care and long-term care team, and also engage in various quality and in Medicaid. I have a background in family medicine, preventive medicine, and public health, with a focus on public health administration and practice. And again, I'm very glad to join the team here.
Thank you, Dr. Alishar. I guess, does anyone have any questions for the new board member?
Yeah, David, it's Jerry.
Hi, Jerry.
Did you say that the Dr. Alshir is now a member of the board?
He is representing a commissioner of the Department of Health. So he's appearing as a commissioner ex officio.
Oh, okay. So he doesn't fill any of the current vacancies. That was my question.
Oh, yes, correct. He does not fill a current vacancy.
Thank you. And welcome.
Thank you.
So the next item on today's agenda is the approval of the 3 prior meeting summaries. So will one of the voting members, if they'd like, make a motion to approve, or of course, if there are any errors or issues within those minute meetings for a discussion, this is certainly the opportunity for that.
I'll make a motion to approve.
Okay, is it seconded?
Second.
I'll second it. Second.
Okay. Any voting member of the board abstain or object? Nope. Okay. So the 3 prior minutes, June 7, September 20, and December 6th, been approved. Before we go on to the department and subcommittee reports, we do have a special guest appearing today, and because of a possible conflict issue, I just wanted to take the opportunity to introduce Kim Hill of the newly established Office of the Chief Disability Officer. She welcome to stay the entire meeting, of course, and have discussions with all the board members. But we just wanted to ensure that we provided Ms. Hill with an opportunity to appear and speak to the board before potential conflict. So, Ms. Hill, are you there?
Yes, I'm here.
Oh, there you go.
Hi.
Nice to meet you. Welcome to the board. We are so grateful to have the opportunity to have you appear. I know at least one of the board members knows your organization in the new office, but we thought it would certainly be a great opportunity, if you don't mind, to speak a little about the office and your role and who you are, if that's okay.
Yeah, sure. Hi. So my name is Kim Hill. I'm the new Chief Disability Officer. I am in my, I think, 4th week on the job. So since we're building this office from the ground up, it's been a big learning experience. From what I can tell, I've been reached out to by a number of different disability organizations. It runs a gamut: physical, sensory, developmental, in mental health. We're going to cover it all. We're going to be representation in the chamber for all types of disabilities. So right now I'm in the process of hiring my staff, dealing with some budget, and just getting to learn the second floor and what issues I expect will become important. I worked for the legislature for 24 years, well, actually 28 years, 24 years in disability issues. So I think I've got a pretty good handle on what is going to be coming my way, but we'll see. It's a whole new role over here on the second floor. So I look forward to working with all of you. I expect to be hearing from all of you in different ways. Jerry, I've already met with you a couple of times, I think. So it's good to see you. So thank you for welcoming me. I hope that I can stay for the entire meeting. I will do the best that I can. And I'm looking forward to helping a lot. Thanks.
All right. Thank you so much. So obviously, we now have this new office as a resource. Obviously, since it's new, we won't try to take advantage and send too many requests at this time, but certainly in the future. I think we'll certainly be able to collaborate and work well. And so again, on behalf of the department, we thank you so much for joining us today and making yourself available. We know how busy you are nowadays. So thank you so much.
Thanks. No, I really appreciate it. And feel free to take advantage. I can't promise how quickly that we will get back to you or schedule. I don't even have my own executive assistant yet, but I do want to hear from all of you. So reach out when you feel that you have something to bring to our attention.
All right. Thank you so much. So with that, if unless any of the members have something at this point, we'll continue with the regular agenda. The next item is the department and subcommittee reports. The first report is the enforcement report from Investigator Bolello.
Hi, good afternoon. I'm Jack Bolello. I work for the Division of Licensing Services Enforcement Unit. I put together a short enforcement report for the period of December 21 to March 2022. I believe those invited to this meeting were forwarded a copy of this report by email. So I'm just going to go through the different categories of the report. Excuse me. So the first category is the total number of consumer complaints that the department's received since the last board meeting. And the answer to that is 0. We haven't received any since the last board meeting. The total number of complaints closed since the last board meeting is 3. The total number of pending investigations is 5. And those 5 complaints have been put into different categories. 2 complaints have to do with allegations that certain hearing aid dispensers demonstrated incompetency and failed to issue a refund to a consumer. So we have 2 complaints in that category. We also have 1 active investigation regarding a dispenser that is allegedly offering online hearing aid service. We also have a complaint about a dispenser that allegedly is engaging in misleading advertising in print media. And the misleading advertising has to do with an allegation of the dispenser is advertising things beyond the scope of hearing aid dispensing practices. And we have an additional complaint about a certain hearing aid dispenser that was issued a registration purportedly by fraud or deceit by way of the assistance of another dispenser and who is also a registered hearing aid dispenser instructor. So those are the 5 complaints that we have. And the other category that we have is that in the last 12 months, the department's received 2 complaints regarding the hearing aid dispensing business. One is against a specific dispenser, and the other complaint is about a specific hearing aid business. And we have not received any complaints in the last 12 months regarding audiologists.
Is there anything else part of the report?
That is it.
All right, thank you so much. Does any of the board members have any questions for Investigator Bilala?
No.
All right, thank you so much, Jack.
Thank you.
Next item on the agenda for today is the processing report by Emily Lupi. Emily, are you there?
Good afternoon. This is Emily Lupi. Included in the materials you were provided, you will find licensing statistics for April of 2021 and February of 2022. The report shows the number of hearing aid businesses broken down by county, a business list broken down by class code or license type, and a report of hearing aid dispensers broken down by type and by county. Please note that the 2021 numbers include only licensees and do not include those licensees whose licenses may have expired, but were covered by Executive Order 202.11, which allowed individuals licensed by the Department of State to extend the expiration of their license during the state of emergency. That concludes the processing report.
Thank you, Emily. Do any of the board members have any questions regarding the department's processing report? No. Okay, thank you so much, Emily. Appreciate your report. Next item on the agenda is the education report prepared by Allison Lacey. Allison, are you there?
Yes. Good afternoon. The Bureau of Educational Standards continues to audit hearing aid dispenser renewals. Those renewals which do not indicate approval code numbers or do not appear to include T-coil, infection control, and New York state and federal law, in addition to the balance of required hours, are not processed and sent to the Bureau for an educational compliance audit. A renewal license will only be granted when satisfactory proof of education is provided. So far in 2022, 39 licensees have been audited and 22 have complied. 8 licensees did not comply. Of the 9 pending, all are within the time frame to respond. A new regulation went into effect on December 7th, 2021 that allows for hearing aid dispenser education providers to offer qualifying and continuing education courses in a live distance education delivery method. Now, live distance education means providing instruction in real time where the approved instructor and the students are physically separated, but the use of remote technology allows each person participating in the educational program to view and communicate with each other in a live and interactive manner that transmits simultaneous live audio and video. Course availability appears to be adequate and has not been an issue raised by licensees. Are there any questions?
No. All right. Thank you so much, Allison. The last department report is the examination report.
I think Barbara had her hand
sorry.
muted. Are you muted, Barbara?
No, 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 no.
Okay, she had a question, I think.
Well, why don't we
Yes, I
give
am.
her
Sorry.
opportunity?
I wanted to know, Allison, what was the number of that live distance education?
I'm sorry, what was the number?
You said that as of something, either a date or there was a
December
movement?
7th, 2021.
That was it and nothing else? I thought it went through before that, to be able to do the
No,
live
that was a
distance.
temporary live distance education approval period. Now live distance education has been added. It's section 159.1.
Section 159.1, and it is now possible for that that will continue after, as we go through the rest of COVID or after that.
Yeah, that's a permanent regulation.
Terrific. Thank
that
you.
the department promulgated. You're welcome.
Thank you. It was that code number. Thank you, Allison.
Thank you, Allison. Does any board members have any other questions for Allison?
A small question regarding the live courses. As a provider, some of the manufacturers are reaching out with live courses, but not many of them or not many of the classes have been state approved. Is there a particular process they need to be reaching out to or someone indirect?
So the live distance education regulation allows providers that are already approved by the department as a regular course provider to seek sort of additional authorization. So in this particular instance, the entity wishing to provide it would have to go through the regular course approval process the same way a traditional provider would. And then once they're approved, they would then provide additional information to the department about the specific sort of technology used in order to ensure adequate education to the students. So they should contact our education unit if they have any questions. So again, before we go on to the last report, I just want to make sure, does any board members have any other questions regarding the education report for Allison or for the department? Oh, looks like Barbara has her hand up again. Barbara? I think you're on mute again, Barbara.
Okay, sorry. I've gotten questions and I answer no, that's not appropriate. People have said when a hearing aid manufacturer's representative comes into their office, can that count as a continuing education? And I say no, because they're not prior approved, they're not prior approved instructors, and they have to have course content, not sales content. I just want to verify that and to make sure that everybody knows that so they can spread the word.
That's correct, Barbara.
Good.
So is there anything else from the board on the department's education report?
I have a question.
Sure.
For Allison, what's the best way to reach you if we have questions in the future? Do you have a direct email or a phone number that we can address questions?
We have an email address and we have a phone number.
Can you share that?
Our phone number is 518-486-3803. And it may be easier for me to send the email address using print because to spell it out, it might get confusing over this WebEx system.
Okay, perfect.
Of course,
Thank you.
any of the board members, if they have questions, they should certainly feel free to email me or, of course, Denise. And, we'll do our best to be responsive.
Thank you.
So, of course. Okay, so the next and final report is the examination report by Shannon Mcguire. Shannon, are you there?
Yes, I'm here. Hello. Can everyone hear me?
Yes.
Okay, perfect. The following statistics cover exams administered in 2021. The hearing aid written exam was administered to 52 applicants with a pass rate of 50%. The practical exam was administered to 113 applicants with a pass rate of 86%. Are there any questions on that? Thank you.
I'm sorry, Shannon. Can you? I have a question. Sorry.
Sure.
So I just had a question about the written exam, because there has been some confusion as to AUD students taking the written portion of the exam from what's in the hearing aid registration application. If you're an AUD student who has done your coursework, met the requirements is the same as a hearing aid dispenser, you can apply to take the written exam and have the university instructor sign off that you've completed your coursework. I just want clarification that this is the case from the state, because there's been multiple applicants that have been audiology students who have tried to take the written exam using this method and have been told by the state that this is not an acceptable method. They have to wait till they are graduated from their AUD program. So I just want clarification from the state that what's on the application is correct, and the department who's processing these requests is aware that these students are in fact able to take the written portion of the exam, or if I'm missing something.
Yes. Yeah, I believe you had sent that question through to Denise earlier.
I
It's
did.
something we're going to look into a little bit more before we can respond.
I'm just wondering what it is that you would need to look into, considering that it's on the application. It's on there is a category on the New York State Hearing Aid Dispensing registration form, and I think it's number 4 that you are, Barbara, did you have a comment?
So it looks like she's on mute. However, I'd be more than happy to look into it.
It's not a question of looking into, it's in the law.
Right,
It's in the
law.
regulations. And the
Okay.
university supervising instructor for an audiologist, the audiologists were audiology students were given a 3-month requirement for education and if they feel they're up to taking, they know enough in terms of coursework and clinical work to take the exam, they can file to take the exam, fill out number 4, and then register to take the exam for both the written and the practical. It's only the audiology who is already licensed, who's gone all the way through the process, who then takes just the practical. If they elect to take the written and practical while they're in their AUD program, all they have to do is promise to continue to remain in an AUD program and be registered in an AUD program.
Okay, so
If
Anne,
you
you
want
had
the
mentioned.
regulation citation, I'll send it to you.
No, that's all right. But Anne, you had said that you had just emailed that question to the department a little while ago. Is that correct?
Yes, and then after I emailed it, I looked and I saw that it's right on the application. So I just wanted to make.
I was just asking, do you mind forwarding me your email so I could look at it as program counsel? If it is a legal issue, I'd be looking at it anyway. So do you mind forwarding me the email that you had sent to the department to make sure that I have an opportunity to review it?
Absolutely, Dave. I will. I will email it to you.
Okay.
I guess I was just my concern was that this is something that's written into the law and the application, and
I don't want to. I obviously am not in a position to speak about this because I haven't seen your question. But if it is something that involves the law, certainly happy to look into it, and I will do my best to be responsive. I just haven't seen the question, so I think I'm not going to be in a good position to answer your question at the moment. But if you email it to me, I'll glad to take a look at it for you.
I'll forward that to you. Thank you.
All right, thank you.
I had a question for Shannon. Shannon, you cited 50% and then 80%. Can you just, maybe if I misunderstood you, is the first pass rate 50%?
Yes, so the pass rate for the written exam is 50%. The practical pass rate is 86%.
I see. And do you guys stratify between the AUD student or AUD examiners versus hearing aid, straight hearing aid, or you just have a one number?
So for the practical exam, we had 66 audiologists with a pass rate of 89% and 47 trainees with a pass rate of 80%.
Okay. All right, thank you.
You're welcome.
The written, it was only hearing aid dispensers, not audiology students?
Correct.
So do any of the board members have any last questions regarding the examination report by Shannon Mcguire?
I do.
Make sure oh, okay.
I have a question. Who is allowed to make comments during the meeting?
Generally, it's just supposed to be scheduled guests or board members, department staff. But I do see that Barbara was answering questions, but usually for these meetings, there's no public comment section.
Okay, thank you.
David?
Yes.
I have a couple of questions or points.
Okay.
Regarding the licensing and application process that the department oversees, at the December meeting, as reflected in the minutes, I had asked for some data to be compiled so that we have some trend information as to the degree of interest in the audiology profession, the dispensing business, hearing healthcare, as well as to get a better handle on
Do you have the printouts?
how successful the training and education is in terms of pass-fail rates from year to year. You had referred that at that time to Shannon Mcguire, and I don't believe received any trend data along those lines. And I would just renew that request and also point out that one of the reasons there's so many gray areas or areas of uncertainty about hearing healthcare and audiology in New York State is the lack of a commission or an agency state level that really can dig into the hearing healthcare problem that is hearing loss and would also encompass deafness and deaf blindness from an accessibility advocacy standpoint. So I would repeat that. I wanted to just repeat that request. Also, if the next item of business is any remaining new business, I would like to introduce the question regarding a bill that is currently before the legislature. It's in committee, and that bill would enable physicians.
Sorry.
So I would like to be able to address that at the appropriate time, David.
Sure. So a couple of things, if I may, regarding the statistics. Apologize for that. We do provide as much data as we think we have available. So if it's a matter of seeing other data points that we might be able to research and compile, I'm happy to work with department staff on that. And so hopefully we'll have that for the next meeting. We do have information, obviously, on number of licensees, number of applicants. So if it's a matter of looking for historical data and providing that, certainly we can provide that in a more clear fashion. But we'll work with licensing on that, certainly. Your second point, sorry, you had something you wanted to add?
The second point was about a bill that's currently before the Senate.
Well, no. So Jerry, your second point. Sorry, Jerry. Your second point, I believe, was about having an office on the state level to help with certain advocacy issues. We believe that the governor's passage to create the Office of the Chief Disability Officer does that, which is why we invited Ms. Kim Hill here to, inform the board of that office to help with, certainly advocacy issues. So we do hope that we will be able to collaborate with her office and with that agency to try, where feasible, to address those issues. The third point regarding the bill that you had, oh, yes, Jerry?
Let me clarify a bit on what you just said. I'm not talking about advocacy now. I'm talking about policy making, decision making that's informed, and the legislative process, which has a tendency, it seems, to run amok with respect to bills being introduced by well-intentioned legislators without proper vetting or consideration or consultation with the various groups, whether it be the audiology fraternity or Hearing Loss Association, which represents consumers, or the dispensing organization. And I wanted to bring up, well, let me say two things. As I've mentioned before, we are putting forward a bill now that would create a commission for the deaf, blind, and hard of hearing. And our hope is that that organization, which is one that exists in 38 states, but not New York, would be effective in shedding light on a lot of issues having to do with hearing health care, public welfare, the impact on the medical business, et cetera, et cetera. But what I specifically referenced a moment ago was S2565. So I'm curious to know why the dispensing board was not aware, or the department was not aware of this to bring it before us, because this bill, which I gather has come up annually,
Jerry,
from the Medical Society, wanting to expand the hearing aids.
So Jerry, thank you for that introduction. I actually had a conversation last week with Dr. Kim, as you know, who sits on the board, specifically about that bill. We didn't want to surprise the board members by asking them to give an opinion on the spot about this bill, which they may not have an opportunity to learn about. So I had spoken to Dr. Kim last week. I'm planning on discussing it now. So thank you for that opportunity introduction, because this is exactly what Dr. Kim and I had discussed, which was there is a current Senate bill S3380. That bill has been introduced in the 09, the 11, the 13, 15, 17, and the 19th legislative session. What that proposal does, it would seek to amend GBL section 802 by removing a specific sentence of that law, which states no otolaryngologist or other licensed physician who has conducted a medical evaluation of hearing loss shall engage in the dispensing of hearing aids for a profit. That's what the bill does. Now, from the department's perspective, obviously, we didn't want to surprise any board members by putting them in a spot to publicly take a position on a bill that they may not have been aware of. So I wanted to mention this bill to the board with the idea that at our next open meeting, the idea would be that the board members would be in a position to ask questions about it or make potential statements about it, with the understanding, obviously, that the Department of State is a regulatory agency responsible in part for enforcing the laws as written. Now, just for awareness of the board, this legislation in its current form has existed since 2001. The prior version of the law that was enacted is strikingly similar in that it also prohibited hearing aid dispensers for selling for a profit, with an additional proviso that non-for-profit specifically includes the cost of the hearing aid plus such other unreasonable expenses as the department may establish through regulation. Prior to the department ever being in a position to establish the regulation, the law was appealed to its current form, which is why that the position of the department has always been that it's for-profit means the cost of the hearing aid, but in looking at other provisions of the law, we recommended that a 5% of the cost of the actual acquisition would likely fall in a safe harbor. So it's the department, what we wanted to do is just to inform the board members of the proposed legislation. I know Dr. Kim wanted to invite somebody at the next meeting to be able to speak on this. And so we wanted to provide the same opportunity for all board members so that none of the board members, as I said, Jerry, were in a position to have to speak on this without having an opportunity to be aware of the law and legislation. So certainly if anyone would want to discuss it more fully and in depth and take a position on it, we invite the board members to do so at the next meeting. And between then and now, obviously, if any of the board members have questions about the law, want a copy of the law, or have a question about it, certainly feel free to email me and I'll be more than happy to try to assist where I can. So does that hopefully address that third point of yours, Jerry?
Yes, thank you for that very comprehensive analysis from a legal standpoint. You lost me about halfway through, but I think if you send out an email to us in preparation for the next meeting and you translate some of what you said into lay language, we'll be able to have a good discussion about it at the next meeting. I should just mention, the only reason I raised it is that the Hearing Loss Association was contacted by the office of the Senate Majority Leader for our opinion. So we did go ahead and express our opinion after polling members of our professional advisory committees.
Great. And obviously, it's just a reminder, the department will continue to enforce the law as written in the way in which we believe is supported by the legislative, history. And obviously, we will continue to try to ensure that we fulfill our sort of legislative mandate on this area. So definitely, I'm sure this will be something that we will be discussing in greater depth at our next meeting, which is currently scheduled for June 2nd at 1. So hopefully all the board members, have that written down and will be available. Does any members of the board have any questions?
Yes, David. Another question going back a short bit for Shannon. You had mentioned the pass rate on the exam. Do you have a breakdown from the first test, the first practical and second practical? What is that ratio of how many people are passing and restudying? And the second question that goes with that is there a particular area of study that providers need to focus more on not pass over, but focus more on to be a better provider. Something where they're not showing competence in the first round, that maybe we get out there and say, you know what, this is a general area where you folks are missing. You got to put more emphasis here. Not just.
I'm sorry, what was your first question?
Is there a breakdown out of that percentage of people that pass and fail? What is it the first evaluation, second evaluation, because they get 3 attempts between that and the practical? And then is there an area of concern that, for example, real ear measurement, it's a strong part of practice, best practices, but if people aren't focusing on real ear and they're not going to do real ear, and that's where they're missing on the test, causing them to fail maybe, can we somehow get that information, say, you know what, you really got to focus on real ear, and then maybe advise providers to do best practice?
So our statistics don't break it down between first time or repeat test takers. I would say anyone that fails an exam, if it's a practical, they can request an analysis that will show you the areas that they may need to improve on. And they may also request a review of the written exam, which will show them, the areas that they might want to focus studying on a little bit more.
But we don't have, there's not like a statistic on so many areas, this area being missed or another area being missed.
I don't have the statistics broken down by test subject to share with you.
Is this something that can be done?
We can look into that. I don't want to say yes. I don't want to promise anything, but we can look into that.
I appreciate it. And one more note and appreciation with what Jerry's saying on the other aspect. I think I shared it last year. I did another study where I wound up with a surprising percentage, and this is not an adverse number, but we're talking about advocacy for the hearing impaired community. And I think some of us are going in the wrong direction. If our physicians are able to share more information about hearing health and prepare their patients as they go, more people will get help. I always ask the question, and that is, has your physician spoken to you about hearing loss? And that number is very low. And so Dr. Kim and Dr. Elsher, when we talk about the advocacy for hearing impairment, the first place I would think we could look at is how to get that information out to our physicians. And not saying they're going to dispense or not, but just simply say, get a hearing test. We're getting eyes checked and teeth checked, but no one's focused on this until well into their 60s and 70s. And if I remember right, the American Medical Association has a recommendation of every 2 years after the age of 50.
Yep.
I think if we could advise the board on that to get that information out further into whatever program there is, that's the advocacy I think could help the most, get our hearing care community in New York on a better track. And I'll leave it there.
Eric, a couple of years ago, the American Academy of Otolaryngology met with the Academy of Geriatrics, met with the Academy of Family Medicine, and we came up with kind of a guideline for the aging population. And I can certainly get to the committee the recommendations that were formed as a result of that multidisciplinary meeting. And that's something that we should, it's an educational pamphlet that somehow it should be accessible to the New Yorkers.
I agree, Dr. Kim. I was asked by a patient's spouse who actually is an instructor for SUNY to put something together for them to talk to their students as they're going through their first year at SUNY and my local SUNY campus. The concern I have is too many patients have come into my office. They're expressing issues of vertigo, for example, and there's never been a hearing test when they've been to their physician. There's not the referral about hearing, whether it's vertigo or a person that has cognitive decline There's a new study that's come out. I heard about it through my company, but basically, patients that have been tested for cognitive decline, when retested after being refit or being fit with hearing aids, that it's at a lower rate or lower status. So how can we get that information, like you said, out there more? Can it come through our board like we did with the purchasing guide? Get that information. Because we're all talking about advocating, but the doctors are the first responders to a patient as they're aging and when to get that help.
Well, it shouldn't even just be left up to the doctors. It should be more patient education in general.
Agreed.
I think the timing is really good on that, with more information coming out about hearing loss and other comorbid conditions. It's really gaining a lot of momentum, and there's a lot of research coming out. So I think the timing is pretty good to get that education out to consumers. I know practices do it at a practice level, many do, but I think it's great general public health information.
Yes.
Absolutely. I mean, the ones that are informed will go to HLAA that Jerry's a big part of, but for the most lay people, they don't even know where to go.
Oh, that's where the physician, that point could be helpful. Even if it's our ophthalmologist. I've had patients come tell me after they've been developing macular degeneration, their ability to process speech and understand has been diminished in their subjective of their hearing. And when the auditory tests are done and they're at 60%, 70%, but visual cues, they're at 80, 90%, and they lose the visual process. And now they're saying their hearing's going. That's information that should be coming from the physician to say, no, your vision was helping. You need to get a hearing test if you're not already there. So anybody help on that? I'd love the conversation further.
I mean, certainly, I think what some of the other board members have said is that, certainly this is a general sort of consumer information and awareness, and the timing of this is definitely key. Once the consumer thinks that they're purchasing a hearing aid, to your point, it may already be too late. So, it's one of those sort of regulatory issues from the department's perspective. I think we could speak on that because we license the dispenser, right? We don't license the physician. We do have sort of a consumer outreach component or arm. So it's just a matter of whether or not the information that we currently have is sufficient. But I don't think it's going potentially to ensure where the physicians are going to sort of do this uniformly. The department. Yeah.
And that's why I'm hoping that this falls on on Dr. Kim and on Dr. Alshear with those departments, that maybe this information could get to where it needs to go.
Yes, I second that. And I was also going to ask Dr. Alshear if he would make a note about this as an important health education point that needs to be promulgated a lot more. And this will happen, I think, also to a greater extent if we can get a commission established in Albany to represent the entire realm of deafness, deafblindness, and hearing loss. And these agencies can work more closely together in the public interest.
So thank you, Eric and Jerry. Is there any other new business from any board members at this time?
I would ask if there's anything new from anyone's perspective with regard to the FDA's approval of over-the-counter devices. And I do want to remind and thank everyone for their efforts that helped get our state's Attorney General to put out an alert for consumers to be wary of some of the practices that are going on in the interim. But I would just ask if anything's new on that front.
So
Hi,
I can tell you what I know, Jerry, and then obviously certainly any of the board members could certainly feel free. But last I'm aware, the official public comment period from the proposed FDA regs expired after our last board meeting. So our last meeting was in December. So after our meeting, obviously, this is the time period I'm talking about. So at this point, really, it's just for the FDA to, I guess, make a determination on how they're going to advance their proposed to a final rule. So.
Yeah, hopefully that will come through this current year.
Well, can't speak for the FDA. Does any the board members have any thing that they'd like to add in response to Jerry's question, or anything that they want to add? Might be able to assist.
Yeah, this is Brant Campbell from the New York State Attorney General's office, and I was just going to add that, I'd asked our office to run the number of complaints that we've received regarding hearing aids, and the volume is still relatively low. We've received 7 complaints starting in January. So the volume is relatively low, and they detail sort of different sets of issues regarding refunds for hearing aids that don't work, problems with insurance. So we have the ability to track complaints that come into the office. So as the FDA legislation goes through, we'll also be able to track our complaints and see if there's an increase in volume. And our office is also involved in an organization called the National Association of Attorney Generals, where we meet with other state attorney generals, and there's a subgroup that's looking into hearing aid fraud. So to the extent that there are items that that are worthy of bringing to this venue, we can share that with you as well.
Brant, I have a question for you. I'm not sure if you'd be able to answer. So anybody who purchases a hearing aid in New York State currently, they need to provide to the patient that complaint number, have it posted so patients are aware of what number to call. So I was just wondering if anybody had any information. Is that same complaint number going to be provided to patients purchasing these new devices over the counter or internet?
Yeah, I do not know the answer to that, but it's something that we can certainly look into.
Yeah, I was just wondering, like, how we would really know, the difference if the consumers who are buying certain products aren't aware of the number.
Right now, and some of the details might be in the legislation, but I'd have to dig deeper to see if there's anything there.
Thank you.
You're welcome.
Thank you, Brant. So does any of the board members have anything else that they would like to mention or respond to a prior comment or anything like that?
I think Barbara had a hand up again.
Actually, I think Fred Goosen and I. if we can speak about the FDA and the over-the-counter.
There isn't really a public comment portion. I apologize. I should have noted that earlier when you were
There
answering.
used to be a place where the visitors could have a chance to speak.
Yes. In other meetings or previously that had been something that was scheduled. But since we've moved with the virtual meetings, in order to be able to try to ensure sort of efficiency in the discussion, because we can't really know what's going on in the online world, we did remove that from the agenda. So that's why it's not listed.
And we put it back on then for future virtual meetings? If I feel that if there's advocates in the community, whether it's Fred or anybody coming through the state that wants to discuss a matter, if they're going to take the time, I think they should have their moment.
Sure. So, but I mean, like, you mean like a scheduled agenda item, or like something on a particular concern, or just open the floor to anyone?
Like we used to for 10, 15 minutes, if that's what it needs to be, or if they could put the questions ahead of time, that's great, but they don't always come up, obviously.
Right. So, I mean, certainly the advance notice would help sort of for the efficiency, the same way in which I had this discussion last week with Dr. Kim when she wanted to approach the board with the current bill to propose the statutory amendment to GBL 802. We didn't want, as I said, to put the board members in a bind to have to speak on a bill without sort of a heads up. So certainly if, there's a particular item that any of the board members, or if they have a guest that they would like to present a discussion on a particular topic, certainly more than welcome. But I think at this point, if the only thing we have is just, one comment from Barbara, we're certainly, happy to entertain that now if you want to speak, Barbara. Looks like you're on mute, Barbara.
Get my finger on it. The FDA document groups things into over-the-counter and then prescription hearing aids. The entire law and regulations are going to need to change. And over-the-counter is not regulated by anything but the FDA. And Fred is nodding his head. Yeah, I could see he was saying the same thing that I was. It's buyer beware. Consumer can buy and do anything. So that's one. And I think looking specifically or forming some committee to address what's coming and how the changes might take place. It's likely to come out as early as June and late as maybe September, October. I still haven't gotten a response to my 8-page document that I wrote, and I know several of the board members wrote very good positions because all of them were available at the FDA website.
A brief comment, please. Point of order that the Department of State has no authority over over-the-counter hearing aids because no one selling over-the-counter hearing aids is a registered hearing aid dispenser. Very similar to the person who sold hearing aids online, who was a dispenser. The board has no coverage over Lively hearing aids or Eargo or the other online blatantly for sale hearing aids because they're not being sold by registered hearing aid dispensers or registered hearing audiologists. They are not. We're not part of the discussion. This board is not part of the discussion because it involves people we have no authority over regulating. Because none of them are going to claim to be registered hearing aid dispensers. They're salespeople. They sell socks and hearing aids. And the state cannot alter the FDA rules. The FDA rules stand with no adjustments, no alterations allowed by the states.
Yeah. Thank you for that Fred, and I agree. I mean, I think I had mentioned this in the last board meeting when I was giving the update, how the FDA statute expressly provided a statutory preemption over state regulation. So thank you for that comment, both of you. Does anyone else from the board have anything else at this time?
I have one point, just a point of information. Tell me if I'm correct. I looked at the roster of our board that was accompanying the agenda today. We have 13 statutory positions on this board. 6 of them are vacant. I dare say at least half of them have been vacant for 2 years or more. I could be wrong. But my question to the staff is, why does this continue to be such a poorly staffed, I shouldn't take that back, why we don't have a full complement? I compliment everybody who's here today because otherwise we wouldn't have a quorum. But it seems to me that somewhere between the Department of State and the governor's office, there's a breakdown in the recruitment and appointment process that results in our being on this board. So I would ask again that somebody try to get back on track. 2 of the 6 vacancies are for consumers or consumer-related slots. And never has the staff ever asked me to reach out to try to find somebody. It's only when I've raised the issue that I've been told by Denise, well, go ahead if you know anybody. But I think that we could do a lot better collectively.
So, well, if I can, I just want to respond to that on behalf of the department. So we are working with our Intergov Affairs officer. We are looking for qualified applicants and candidates that do satisfy the specific statutory requirements, as well as just like to note that
What are you doing in that respect? I've heard nothing.
We have a specific staff person that is responsible for receiving the information, working with the governor's office to pass along the resumes of these individuals to try to get these people in a position where they can be appointed. We cannot obviously require that the governor make a particular appointment. So we are forwarding as much information as we can to the governor's office regarding specific people who do satisfy the specific statutory requirements. Also, there is at least one other position that is not appointed by the governor. So obviously, neither the department nor the governor have any control over that vacancy. And as we've said at every board meeting, obviously, if any of the board members or the regular public participants are aware of individuals that satisfy the specific statutory requirements for appointment in terms of the position, we welcome this at every time. So it's not as if we have to tell you to send somebody to us until there's complete board composition. Obviously, we welcome the opportunity for anyone to forward those names and information to us, but ultimately, it's up to the governor to make those appointments. We can't speak to as to why some appointments may not go through the vetting process.
How many appointments are currently pending?
Well, I mean, as you said, there are 6 vacancies, so in theory, there's 6 vacancies pending.
I didn't ask about vacancies. I asked about appointments, because you're saying that you put forth candidates and the governor's office makes appointments. Tell me what's going on in that regard.
Eric, one moment.
I'm not sure I could answer that question any differently than I already did.
David,
you're not telling us anything.
David, we've had very, very good success from the department. Your office has approached us. We've talked the new governor's policy and openness. We have been making appointments, and I commend the department for reaching out and accepting and moving programs along. I think the change in governorship has made a big change in how these things are going to happen. And I encourage you, if you have people you wish appointed, to remake the applications to them, because I know that we've worked with the department and so I think we're in good shape moving forward. I think the department is doing a good job.
Thank you, Fred.
Thank you, Fred.
So I guess I'll just ask one last time. Does any of the board members have anything that they'd wish to discuss? So looking around, seeing a lot of head shaking. So is there a motion to adjourn from one of the voting board members?
Second that.
Second.
Anyone oppose or abstain? All right, thank you, everybody. With that, this is the end of the March 21st board meeting for the State Statutory Hearing Aid Advisory Board. Thank you so much, everyone. Appreciate your time.
Thank you.